What if I told you there's something in your kitchen right now, something that costs just cents, that could help with 13 different health problems, and most people have no idea? It's not a pill, not a supplement, and it's not new. In fact, it's been sitting quietly in your fridge, your pantry, maybe even under your sink. Baking soda. Over 80% of people use baking soda for cooking or cleaning and completely miss its biggest benefit: health. Some scientists have called it the most overlooked natural remedy on Earth. Even major institutions like the Cleveland Clinic, Harvard Medical School, and the Journal of the American Society of Nephrology have studied its impact, from slowing kidney disease to improving exercise performance. According to a clinical trial led by the University of Alabama, baking soda, sodium bicarbonate, helped reduce inflammation and balance immune response in people over 60. And in a review published by WebMD, low-dose baking soda was shown to ease arthritis, reduce heartburn, and support oral hygiene without the side effects of medication when used correctly. For seniors over 60, 70, even 80 years old, baking soda could mean less pain, better digestion, stronger immunity, and more comfort, if you know how to use it right. But here's the part no one tells you. Using baking soda the wrong way can be harmful. That's why in the next few minutes we're breaking down the 13 science-backed ways baking soda can support your health, plus who should avoid it, and how to use it safely. Stick with me to the end, because one of these simple tips might be exactly what your body needs. Let's dive in. 1. Supports detoxification. Baking soda isn't just for cleaning or baking. It may help support your body's natural detox process too. When mixed with water, baking soda becomes alkaline, meaning it can help neutralize excess acidity in the body. While your body already works hard to maintain pH balance, studies from the Journal of the American Society of Nephrology have shown that baking soda may help people with chronic kidney issues by reducing acid buildup in the blood. This can help the kidneys function more efficiently and slow down disease progression. Many seniors also report feeling more refreshed after taking baking soda baths, where the alkaline solution is said to soothe irritated skin, reduce rashes, and calm inflammation. Though science on detoxing through the skin is limited, the comfort and relief people experience is real. Internally, a small amount of baking soda in water, about 1/2 teaspoon in a glass, may support gentle alkalization and aid toxin removal, especially for those prone to acidic conditions. That said, it's important to avoid overuse. Taken too often or in high doses, baking soda can affect your electrolyte balance and blood pressure. Always speak to a doctor before using it regularly. When used wisely, it offers an affordable, science-backed way to help your body reset and rebalance. 2. Improves oral health and teeth whitening. Baking soda has long been used in dental care, and for good reason. It acts as a gentle abrasive that helps remove surface stains from teeth caused by coffee, tea, and certain foods, leaving your smile brighter without the harsh chemicals found in whitening strips. But the real power of baking soda goes beyond just cosmetic. Because it's alkaline, baking soda helps neutralize the acids in your mouth that feed harmful bacteria. This creates a less acidic environment, reducing the risk of cavities, gum disease, and bad breath. A study published in the Journal of Clinical Dentistry found that toothpaste containing baking soda was significantly more effective at removing plaque than standard toothpaste. Another review from the National Library of Medicine confirmed that baking soda can reduce oral bacteria and improve gum health. Just a few times a week, brushing gently with a soft bristle toothbrush and a bit of baking soda can help clean your teeth and freshen your breath. However, because baking soda is mildly abrasive, using it daily or brushing too hard can wear down tooth enamel over time. Dentists recommend using it 2 to 3 times a week and avoiding excessive pressure. It's a safe, affordable way to enhance your oral hygiene when used correctly. 3. Helps alleviate heartburn. Heartburn affects nearly 1 in 5 adults in the US every week, and for seniors, the discomfort can be even more intense due to slower digestion. That burning sensation in the chest and throat comes from stomach acid rising into the esophagus, often after heavy, fatty, or spicy meals. Baking soda offers a fast, natural solution. Just 1/2 teaspoon mixed into a glass of water can help neutralize stomach acid almost instantly, providing relief within minutes. It works because baking soda is alkaline, which helps balance excess acidity. The FDA officially classifies sodium bicarbonate as a safe and effective antacid when used properly. A review published in the journal Gastroenterology and Hepatology highlighted baking soda as a fast-acting remedy for occasional heartburn, especially in those seeking drug-free options. The key is moderation. Taking too much or using it too often can lead to bloating, gas, or even high blood pressure due to the sodium content. But when used occasionally and under the guidance of a healthcare provider, it's a reliable, budget-friendly option that has stood the test of time. 4. Offers antifungal properties. Fungal infections like athlete's foot, ringworm, and jock itch are more common than most people realize, especially in seniors, where reduced circulation and thinner skin can increase the risk. Baking soda creates an environment where fungi struggle to survive. When applied to the skin as a paste or added to a foot soak, it raises the pH level, making it harder for fungal cells to grow and multiply. In a study published in the journal Mycopathologia, baking soda was shown to inhibit the growth of over 80% of tested fungal strains at a 10 grams per liter concentration. That makes it a surprisingly powerful yet gentle home remedy. Many people use it in a paste, just baking soda and water, applied to the affected area for 10 to 15 minutes, or added to a warm foot bath for daily relief. It's especially helpful for itchy, red, or cracked skin, and unlike chemical creams, it contains no synthetic additives or irritants. While persistent fungal infections should still be checked by a doctor, baking soda offers a safe, non-toxic first step to soothe discomfort and support healing from the outside in. 5th, may relieve urinary tract infections, UTIs. UTIs affect nearly 50% of women at least once in their lives, and the risk increases with age. For seniors, the burning, frequent urges, and discomfort can be especially disruptive. Baking soda, when used carefully, may help ease these symptoms because it's alkaline. Baking soda can slightly reduce the acidity of urine, which may create an environment that slows bacterial growth and lessens the sting during urination. In a study published in the Japanese Journal of Urology, women with recurrent UTIs who took sodium bicarbonate as part of their care routine reported reduced discomfort and better urinary health within just 4 weeks. A typical home remedy involves mixing 1/4 to 1/2 teaspoon of baking soda into a glass of water once a day, but only for a short time and never without medical approval. This is not a replacement for antibiotics, but rather a mild support to ease irritation. Always consult a doctor first, especially if symptoms are severe or recurring. For many, baking soda is a safe, inexpensive addition to a broader plan for comfort and healing. 6th, may treat canker sores. Canker sores, those small, painful ulcers inside your mouth, can make eating, drinking, and even speaking uncomfortable. They're surprisingly common, affecting up to 20% of the population, especially during times of stress or minor injury. Baking soda helps in 2 ways. It neutralizes the acids that irritate the sore, and it acts as a mild antiseptic to reduce bacteria and inflammation. A simple rinse made by dissolving 1/2 teaspoon of baking soda in a glass of warm water can help soothe the pain and speed up healing. A study published in the Journal of the American Dental Association found that sodium bicarbonate rinses significantly reduced pain and promoted healing in people with recurring canker sores. It's gentle, non-irritating, and easy to use several times a day. For best results, swish the solution for about 30 seconds, then spit it out. Unlike store-bought treatments that can sting or contain alcohol, baking soda is mild, making it a great option for seniors seeking relief without harsh ingredients. 7. Enhances exercise performance. You may not think of baking soda as a workout booster, but it's been used by athletes for decades to fight fatigue. During high-effort activities, your muscles produce lactic acid, which causes that burning sensation and leads to exhaustion. Baking soda acts as a natural buffer, helping to neutralize that acid so you can move longer and recover faster. In fact, a meta-analysis published in the Journal of Strength and Conditioning Research confirmed that sodium bicarbonate improves short bursts of performance in activities like sprinting and cycling. For adults over 60 who want to maintain mobility, energy, and balance, that added endurance can make daily activities feel easier. Some trainers recommend 1/2 teaspoon of baking soda in water about an hour before activity, but always start small and consult your doctor, especially if you have blood pressure or kidney concerns. While it's not a magic pill, this simple kitchen staple could be a powerful aid in staying active and independent as you age. 8. May help improve kidney function. For seniors living with chronic kidney disease or declining kidney function, managing acid levels in the blood becomes critical. When the kidneys can't filter properly, acid builds up, a condition known as metabolic acidosis. Baking soda, also called sodium bicarbonate, may help ease that burden. A landmark study published in the Journal of the American Society of Nephrology found that patients with advanced kidney disease who took baking soda supplements had a slower decline in kidney function and were less likely to require dialysis. The researchers noted improvements in blood pH balance and a reduced risk of kidney failure. Typically, a low-dose baking soda regimen is done under medical supervision. This is not something to try on your own, but it shows just how powerful this simple compound can be. For those facing kidney issues, baking soda may offer a low-cost, science-supported way to protect long-term function when used correctly and safely with guidance. 9. Can relieve arthritis pain. Arthritis affects nearly 1 in 4 adults in the U.S., and for many seniors, the constant pain, swelling, and stiffness can make everyday life feel like a struggle. Baking soda may offer some relief, not just on the surface but deep inside your body. A 2018 study published in the Journal of Immunology found that drinking a daily baking soda solution helped shift the immune system into a more anti-inflammatory state. Participants showed a noticeable reduction in markers of inflammation, which are often elevated in conditions like rheumatoid arthritis. The researchers concluded that baking soda may help calm the immune system and reduce joint flare-ups. A common approach is mixing a quarter to a half teaspoon of baking soda in a glass of water, but always check with your doctor, especially if you have other medical conditions. While it's not a cure, it may be a helpful, natural way to manage arthritis symptoms from within, without the side effects of stronger medications. 10th, manages gout symptoms. Gout is one of the most painful forms of arthritis, often striking suddenly in the foot or big toe with redness, swelling, and intense discomfort. It's caused by a buildup of uric acid crystals in the joints, and baking soda may help reduce that risk. Because it's alkaline, baking soda can help neutralize excess uric acid in the bloodstream, making it easier for your kidneys to flush it out. A study in the journal Arthritis and Rheumatism highlighted that alkalizing agents like sodium bicarbonate may help dissolve uric acid crystals and reduce flare-ups. Some people find relief by drinking 1/2 teaspoon of baking soda mixed in water once or twice a day during mild attacks. While this should never replace medical treatment, it can be a supportive low-cost option for managing symptoms between flares. As always, consult your doctor before starting, especially if you have high blood pressure or kidney issues, since baking soda contains sodium. 11th, alleviates cold and flu symptoms. When cold and flu hit, even simple tasks can feel exhausting. Baking soda may help ease symptoms like sore throat, congestion, and mucus buildup. Thanks to its alkaline nature, baking soda can break down thick mucus, helping clear the nasal passages and soothe irritated tissue. One of the most effective remedies is a gargle. Mix 1/2 teaspoon of baking soda in warm water and use it several times a day to calm a sore throat and reduce bacteria. A study in the Journal of the American Dental Association found that baking soda gargles decreased throat irritation and helped reduce microbial load in the mouth, especially useful during respiratory infections. You can also add baking soda to saline rinses for better nasal clearing. It's safe, gentle, and a great way to support recovery naturally when you're feeling under the weather. 12th, might help boost cancer treatments. While baking soda is not a cure for cancer, early research suggests it may help support traditional treatments by creating a less acidic environment around tumors. Cancer cells often thrive in acidic conditions, which can reduce the effectiveness of chemotherapy. In a 2009 study published in the journal Cancer Research, scientists found that sodium bicarbonate reduced tumor acidity in mice and made the cancer cells more responsive to treatment. The idea is that by raising pH levels around the tumor, baking soda may make therapies work better. This has led some researchers to explore its potential as a supportive tool in cancer care. However, it's critical to understand this research is still early. Baking soda should never replace conventional treatment and should only be considered under medical supervision. For those undergoing cancer therapy, always consult your oncologist before making any changes to your routine. Still, this emerging science reminds us how a simple substance could one day play a surprising role in enhancing care. 13. Works as a natural deodorant. If you're looking for a clean, chemical-free way to stay fresh, baking soda might be the simplest solution. Its natural alkaline properties help neutralize the acids in sweat that cause odor, while also absorbing moisture. That's why it's the key ingredient in many homemade and natural deodorants. A study in the Journal of Cosmetic Dermatology found that sodium bicarbonate effectively reduced underarm odor-causing bacteria when applied topically. Just dust a small pinch under your arms or mix it with a bit of coconut oil for a smooth, spreadable paste. It's free from aluminum, parabens, and artificial fragrance, making it a good choice for those with sensitive skin or those wanting to avoid commercial formulas. While some people may experience minor irritation, most find it gentle, effective, and easy to apply. It's a simple, science-backed way to stay confidently fresh all day. Now, who should be cautious? While baking soda offers many health benefits, it's not safe for everyone, especially when taken regularly or in large amounts. People with kidney disease should be very careful. Baking soda contains sodium, and those with reduced kidney function may have trouble clearing it from the body, which can lead to fluid retention or worsening kidney problems. If you have high blood pressure or heart disease, extra sodium from baking soda could raise your blood pressure further or increase your risk of complications. People with digestive issues like ulcers, gastritis, or acid reflux should also use caution, as altering the stomach's natural acidity could make things worse. Pregnant or breastfeeding women should avoid using baking soda internally without a doctor's advice, since it can disrupt electrolyte balance. And if you have sensitive skin, test baking soda topically on a small area first, as it can cause irritation in some people. Finally, never inhale baking soda powder, especially if you have asthma or other lung conditions. If you're unsure whether baking soda is safe for you, speak with a healthcare provider before adding it to your routine. Used wisely, it's a powerful tool, but like any remedy, it must be handled with care. Conclusion. As you've seen, baking soda isn't just a kitchen staple. It's a surprisingly powerful tool that can support your health in 13 different ways. From easing pain and calming your stomach, to whitening your smile and protecting your joints, this simple powder has been quietly helping people for generations. But like any remedy, it works best when used with care, intention, and the right information. If you found this video helpful, give it a like, share it with someone who needs it, and don't forget to subscribe for more science-backed ways to feel stronger, cleaner, and healthier at any age. Your next step to better health might already be sitting in your pantry. Click on the video appearing on your screen now to discover another powerful natural remedy that could change your life.